are jumping right into this topic. Super excited. Representation in medicine. So again, with diversity, equity, inclusion, people are talking about, it's always people jump to a race or a gender, and it can be so much more than that. It's not just about black, white, yellow, green, whatever. It's not about, male, female. It's about our elderly population, our aging population. It's about pregnancy stage. It's about people with different abilities. There's so much more about diversity, equity, inclusion than just the things that our brains automatically go to. And so in expanding upon that definition, I want you guys to tell me, I'm going to start with you, Dr. McDonald, specifically within interventional pulmonology or African-American female interventionalists, have you had a chance to interact with?
So from an interventional pulmonology standpoint, there are 3 African-American board certified.
As in 1, 2, 3.
3. I'm number 1. And then
you're always number 1.
But truly, when I heard the statistic, and I say this to a lot of people as far as, the statistic is really baffling to me because I completed my training in 2019, and how is it possible that in a field where there are so many hundreds of board certified interventional pulmonologists, how could I be number 1 in this day and age? And yet, Wow.
Dr. Grunch, how many neurosurgeons?
In the United States, there's around 5,000 to 6,000.
Okay.
And
That's
then
still not a lot.
not a lot board certified neurosurgeons. And the statistics are kind of old, but the females is about 240 of that. So less than 8%.
Wow.
And then if we talk about women of color, it's like 0.9%.
I remember seeing, specifically for neurosurge, it's a student, she was a medical student, now she's probably a resident, who was like, specifically neurosurgery, it'll be like the first African-American female to match in neurosurgery at like a specific program.
Yeah.
And that just happened in
Vanderbilt.
Tamia
Potter. I met her for the first time.
I was about to ask if you met her.
I did. I met her at a conference about a month ago, and it's like you said, it's crazy to think that she is the first. But I mean, and she's awesome. She gave a great talk at one of our kind of inclusion social media conversations that we had, and it's wild to think that we're still having these types
in 2024. She was the first African American female neurosurgeon.
Resident to match it to Vanderbilt. But you got to think that probably, to April's point, if there's only 3 interventional pulmonologists, I mean, there's these obstacles will still continue to propagate.
Yeah.
So,
what would you change anything about your career? First of all,
I think over time I've become more. I was very hard on myself early on, and it's been a process of growth over time about being less of that, finding joy in the journey, if you will, and really taking every moment in that what I'm doing, find elements of joy to be sustainable. I think I was very early on, very just very focused.
Right.
You have to be.
You have to
to
be.
a certain extent, always in that manner. But very overtly hard on myself, where I didn't necessarily need to be. And I think that if I had approached it a little bit differently, I would have been just a little stressed. More happier at various stages.
Yeah. What about you?
Yeah, I would echo some of that exactly. Like finding joy is important because it gives you sustainability. I think in our level of training and how healthcare physicians particularly are, you're always looking for that next step. We go to school, we go to medical college to medical.
Okay?
There's so many. No.
You need a neurosurgeon.
And then we're always looking to take that next step and focused on that instead of, like you said,
Living in the
enjoying
moment.
and finding joy in the moment, because that will give you more gratitude and happiness as you continue to get through the process.
Yeah.
And I think it's so important to do that. And for me personally, what I would change is learning to take more time for me. In healthcare, there will always be patients to serve. There will always be people that need to be helped.
Yeah.
And we go into healthcare because we want to help people, but we have to help ourselves
Right.
to be the best provider to our patients. And I think that if I would have realized that I can do this to the end of time and still be feeling like I have more to give,
Yeah.
I just wish I would have taken more time to say, okay, it's now time for me. It's time for me to take care of myself. Because at one point in my life, I was very unhealthy. And, I just wish I would have done that.
Yeah. So you guys both have done some pretty incredible things this year that I wanted to talk about and I wanted to give you guys an opportunity to toot your own horns a little bit. Because I do think that it's important for people to see us, understand that, first of all, we're human, we're people, right? So we like music, we like fashion, we like shoes, we like, we're people,
Yeah.
we're people. And so being a physician is only an aspect of who we are. But because we spend so much time in the hospital, in training, all of these other things, these four walls make a difference in shaping who we are becoming. You did a really interesting post on social media where you talked about your experience during residency. And so I want you to talk about that in the context of, you being probably one of the few female residents, because you started out in general surgery, right?
Yeah. At the time, I am neurosurgery trained, but our first year of training was in general surgery. It's different now, but at the time, that's what it was. And so we were in a completely different training environment, different people, different attendings, and a different pool of people than what we interviewed into.
Got it.
So anyway, I'll just say that I thought it was normal, the experiences that I had, because it's all I knew. Okay. And just briefly, to kind of summarize, is when our first day one of internship, we were sat down by the chairman of the program, all the interns that were there, and were given a pamphlet, formal written pamphlet on how to swim with sharks. And that the gist of what the pamphlet was explaining is that you are the little fish and the attendings are the sharks. And so you need to learn how to get along and cohese in this new environment. Again, it's day one. We're just got our MD badges. We're just granted our ability to write orders for Tylenol. And so there was 6 rules, but the 2 that stood out to me most were, one of the rules was don't bleed. And what essentially that translates to, if you bleed, the other sharks will continue to attack. So if one shark made you bleed and then you show blood, all the other ones will be swarmed in and want to attack you more. So don't show your weaknesses. Don't allow yourself to be vulnerable. Don't ask for help. Deal with it, because you will then be prowess to the attacks of all the other sharks in the water. And then the other rule was that if someone else is bleeding, get out of the water. So if one of your colleagues is having a hard time, let the sharks go to them and you see yourself out. So that one's harder for me because, we want to help we want to help each other out. So we were given these rules amongst 4 others to this, and that's day one, stepping into it. So we're told, be hard, deal with it, don't talk about it, don't show weakness, be strong. And it took me 10 years to talk about it. I made this video now almost, well, no, more than that, because I was 6 years in training. So 16 years later, I have this pamphlet in my folder, in my file cabinet, and finally pulled it out and I openly talked about it. And I never talked about it before. And that video went viral because this is an experience that's not only like amongst me, it's amongst everybody in healthcare. I got comments internationally from other countries, from other healthcare professions, from attorneys, from different fields, that this sentiment is taught of toxicity everywhere.
It is. Yeah.
And it's good to talk about it. And the most powerful thing, I don't regret posting it because it has had so much impactful change, I feel like, to openly discuss it. But I will. I had some people at my program, at other programs, be like, why would you talk about this? Were you having a bad day? Someone asked me. Maybe you just had a bad day. So yeah, I think that experience is, and the best part about it was I had many emails, DMs from family members of physicians or people in healthcare that had committed suicide that wanted me to thank me for speaking out, so maybe I could be a voice for their loved one that's no longer here. And that was just, I was not expecting any of that. So
Yeah, I think that is the exact reason why we're doing this.
Yeah.
Is, that was really courageous of you to kind of put yourself out there and get the arrows, but it opened up the conversation on a broader scale about why this matters. The minimally invasive lung cancer surgery that you and Dr. Gersh did with, your expertise in interventional pulmonology. I want you to talk just a few, moments about that and then what that meant for you.
So yes, Dr. Gersh and I, so Dr. Karen Gersh, who is a cardiothoracic surgeon, who is also another fabulous woman that hopefully we'll have on this program one day.
Yes, we absolutely will.
We did a joint case in such that using robotics, me on my side using something called an ion robotic bronchoscopy, marking where a patient had a very small lung cancer, and then within minutes, Dr. Gersh then did her portion of taking out and resecting that lung cancer, and that patient remains cancer-free. And that was about a year ago now, but...
it's been a long while.
Yes,
Yeah.
yes. And that patient is doing amazingly, though, so...
Yeah, and the patient went home...
the next day.
Versus several days.
Versus traditional...
thoracotomy.
Large chest surgeries where the patients would be in the hospital days to weeks with chest tubes and things like that. That's a thing of the past.
Whew.
Innovating.
Yes. So again, representation matters.
Yes.
Because for the younger generation to see, just what you guys have done. I think it's like, it inspires me to want to continue and do more. And one of the things that we have done in way of this is launching our Youth Med program, which is our mentoring program that we have through GME, which takes 8th graders through college and gives them some one-on-one exposure directly with a physician. And so that's just one of the things that we're doing here at Northeast Georgia to not only pay lip service to certain topics or certain situations or issues within medicine, but actually try to come up with a potential solution. We know that we may not get it right every time, but at least we can try. Try until we get it right. All right, we've had so much great conversation surrounding so many different topics, not even just with this podcast, but throughout our series, our Women in Medicine series. So I want to first of all thank you for taking this time to spend with us. And as always, we want to hear from you. We want to know, was this impactful for you? What are your experiences? What do you want to hear more of from us talking about these topics? Remember, please answer the 3 questions and claim your CME credits. Also, stay tuned. This is only the very tip of this series that we are going to be continuing. Some of the things that are coming up that we're going to take deeper dives into is infertility in medicine, which is a very personal topic for me, because if it's not you, then it's somebody that you know. We're going to take deeper dives into physician wellness, and specifically create some curriculum, some grand rounds, and some other talks surrounding not just talking about physician suicide, but talking about programs that are available, and talking about how we are going to move this mark going forward for graduate medical education and our healthcare community. So that being said, I want to thank, as always, Dr. Betsy Grunch and Dr. April McDonald for joining. We hope that you guys enjoy, and we will see you next time.